Osgood Schlatter Disease is a common cause of knee pain seen in growing kids and adolescents. When kids are growing, there is a special part of their bone called a growth plate. The growth plate is a special type of cartilage that contributes to bones growing longer and wider. Cartilage is a more flexible, rubbery tissue than bone, which is firm. When kids are done growing, this growth plate cartilage hardens into solid bone, and bone growth is complete. When a child is still growing, we describe the growth plate as open. When it has hardened into bone, we call the growth plate closed. This is also what we call skeletal maturity. The shin bone is called the tibia. There's a growth plate at the top and bottom of the tibia bone. This is a front and side view of an X-ray showing the growth plates on a tibia. On the front of the knee, at the top end of the tibia, there is a bump. This bump is called the tibial tubercle. The thigh muscles, or quadriceps, attach to the kneecap, or patella, which then attach via the patellar tendon to the tibial tubercle. When kids are walking, running, and jumping, there's an upward pull on the tibial tubercle from the quadricep muscles contracting in the thigh above it. This is an MRI image of a knee from the side, which show the attachments of the patellar tendon from the kneecap onto the tibial tubercle, which is at the front of the tibial growth plate. At the top of the tibia bone is also a growth plate, and the front part of this growth plate is just underneath the tibial tubercle. When kids are active and there is a pull at the growth plate, this repetitive strain can cause stress at the growth plate underneath. The stress to this growth plate can become painful. This inflammation and pain is what is called Osgood Schlatter Disease. Osgood Schlatter Disease most commonly occurs in kids during periods of rapid growth, when bones, muscles, tendons, and other structures are all growing. The added stress at the growth plate from active kids running and jumping can exaggerate the strain on the growth plate and lead to swelling and tenderness in the front of the knee, and sometimes pain with walking or even a limp. Children usually present with complaints of pain at the front of the knee and swelling. The pain localizes to the bump at the top of the shin bone, or the tibial tubercle. This pain is typically worse with activities and improves with rest. Often there is no history of a specific injury to the leg. Pain can be present in one or both knees. Your doctor will evaluate your knees to determine the cause of your pain. They will press around the top of the shin bone at the tibial tubercle and see if there is tenderness with pressure. They will also check if there is warmth or swelling in this area of the knee. Some kids will have a large bony bump at the tibial tubercle. Your doctor may have you straighten your knee against resistance and see if this causes you discomfort. They will also check other areas of your hip and knee to make sure no other causes of knee pain are identified. Your doctor may decide to get an X-ray of your knee. Sometimes children with Osgood Schlatters can have prominence of the bone in the front of the tibial tubercle. The X-ray will also help to rule out other causes of knee pain. The good news for children and teens with Osgood Schlatters is that the pain reliably resolves when they stop growing and their growth plates are closed. This usually happens around 14 years of age for girls and 16 years for boys. Until then, there are some good treatment options for kids to keep them comfortable and active. Treatment options for Osgood Schlatters include rest, icing the painful area, stretching, and strengthening of the leg muscles. Some kids will find relief with a simple knee sleeve or a patellar tendon strap to take some of the tension off of the tibial tubercle. Sometimes if your child is having a lot of discomfort, a short course of anti-inflammatory medications like ibuprofen may also be given to help with the symptoms. Talk to your doctor about using these medications safely. Most kids can remain active during treatment for Osgood Schlatters. You and your child should let their pain and symptoms be their guide. If your child begins complaining of worsening pain or limping, this is a sign that they may need to limit their physical activities, rest, and consider evaluation with an orthopedic doctor. Outcomes for kids and teens with Osgood Schlatters are very good. Most kids can have symptom relief with conservative measures such as ice, stretching, rest, and possible bracing, and the majority of symptoms will go away once kids are done growing. The inflammation of the knee from the Osgood Schlatters can lead to enlargement of the tibial tubercle and look like a large bump on the top of the shin bone. This bump typically does not cause any symptoms, but the bump may be permanent. It is very uncommon to need treatment for this bump. In very rare occasions, kids can develop a break at the growth plate due to weakness within the growth plate cartilage, which could require surgery to repair. However, in conclusion, Osgood Schlatters is typically a relatively benign condition, and most children and teenagers have excellent outcomes and resolution of pain.